right, so health literacy, let's jump into it. For this, we have to understand first that literacy has several different components, several different heads, from finances to being able to just basic reading, writing, understanding how we speak to each other, and also being able to speak. And then we have this other mysterious component of health literacy. So we're going to jump into those. Health literacy today, though, is a topic of focus. Being able to see that our health literacy is going to be the ability to read, understand, and act on healthcare information gives us some clues as to what's important. But being able to basically read, at least at a 5th grade level, is going to be extremely important as we navigate any information that's provided to us through our health. So with that, there are 4 different definitions that come within health literacy that allow us to utilize it well. And that is what's written or printed literacy, numeracy, maybe what's written or what's given to us in a numerical or number format, and how we utilize that information, our cultural or conceptual competency, and that is being able to see across cultures how some things may be lost in translation, or there may be difficult concepts that we have to understand to really break down what a disease means. And so those are going to modify or multiply the ways that we think about our healthcare. And then, of course, oral health literacy. So you just being able to understand what I'm saying and being able to have a conversation about what health may look like next or what the next steps are in a treatment plan. So all these things are going to come into play together. So with that, have an example. And as we think about an 18 to 34-year-old male being African-American, male or female in this particular case, and we look at a white male at the same age, male or female, and we look at the number 7 over 1,000 as a risk for a stroke for the African-American and 4 over 1,000 for the risk of a stroke in the Caucasian individual. What do those numbers mean? Is one person more at risk than the other? What do you think in this aspect? And being able to understand what those means in terms of fractions as they break down into statistics is part of healthcare information. Now, even further, going back to things like our social determinants of health, what are long-range vital signs that we may look at in a situation that aren't going to be necessarily predictive of their color of their skin, but more so where they live, the other diseases that they may have as a medical history, family history, their diet, the things that they have been exposed to over time. Putting all these things together give us some clues. Now, as a bonus question before we wrap up this session, one thing I want you to think about. Over the last 3 years, there's been an infectious disease that's increased the risk of stroke for all ages. And I want you to think about what that might be. And 3 years will be a huge clue here. But we're going to jump into some more healthcare literacy and stay tuned for what happens next.